Thank you everyone for joining us for another one of our Facebook Live events. I'm going to briefly introduce our panel here. We got Dr. Steve Ferguson, the owner and visual medical director at Dunes Eye Consultants and Dunes Lasik Center. We got Lindy Atchison, you're the patient services specialist at Dunes Lasik Center, correct?
Correct.
Okay. And then we also have patient Stacy Spohr to share their LASIK story here today. So I'm going to send it over to Dr. Ferguson, and if you want to just briefly describe to us what LASIK is, we can get going.
Absolutely. I think the general population has a pretty good understanding that LASIK is a surgical procedure to help patients see better, okay, without the need for glasses or contact lenses. It's all laser assisted, and in most centers today that are like ours, it's bladeless. So there's only lasers that are used to create this gentle and very safe treatment. And the question that often is asked, who's LASIK for? Well, it begins with any patient that is dependent upon glasses or contact lenses. So if they're using them to see better or to change their quality of life, they become immediately a possible candidate for LASIK. And then the question also is are there any health benefits? And are there any vision benefits? There are extreme vision benefits because we can correct the visual system more precisely and accurately with customized laser treatments than we can with glasses or contact lenses. So that's very exciting. Health benefits. Comparing contact lens use to LASIK is surprising to many patients to learn that contact lenses carry more medical eye risks to their eyes than having the LASIK procedure, and it's actually by a large margin. And so that's something that we don't often think about when we throw a contact lens on our eye, that it's a medical device, FDA regulated, and it can cause serious problems. And so that comparison often surprises patients and is always an interesting part of our discussion. How does LASIK affect quality of life? Well, obviously, the ability to wake up in the morning and see the alarm clock. I hear that all the time. The ability to not have to put a contact lens in or to put on glasses. I mean, that is freedom. And I've experienced that as a patient myself. I'm a doctor involved with this, but I also have had that experience 20 years ago. And it's the same thing we often say. I wish I could have done this a long time ago. And so it's a very impactful quality of life issue. How do we currently treat? Well, it's all laser vision, right? Laser vision correction. The primary laser reshapes the surface of the eye gently, and that creates a permanent curvature change, which affects how the eye focuses. But we do more than that. We apply technology, diagnostic technology called eye design. Eye design maps out the visual system more precisely than any other way to measure vision. And then we can apply that measurement to the laser vision correction to improve image quality, which means better image quality in low light, especially night, and overall visual acuity. Most of the patients are at a 2015 level following eye design treatment versus the standard 2020 approach that we give with glasses or contact lenses. I think we should have Lindy kind of describe next her patient care experience aspect of how she's involved with our LASIK team.
Yeah, exactly. Lindy, if you want to take that away.
Very good. Hello, everyone. First of all, your first step is to make the appointment to come and see us for a free LASIK evaluation. When you come in to see us, you can contact us either on the website and sign up that way, call us on the phone, and it again is a free LASIK evaluation. You simply come in, you're going to meet with Marcy, there'll be a couple tests. At the end of the visit, you're going to find out if you're a candidate for LASIK. Even on that day, Marcy can schedule you in for your appointment. It's usually the very last Monday of the month. You're going to get in. It's very straightforward. You'll come in that day for your appointment time, and you'll pay before you go back. You'll be given some medication that's very calming, and the procedure itself is 10 minutes or under for both sets of eyes. Both sets of eyes.
Very interesting. Can you tell us a little bit about payment options?
Yes, the payment options, we accept FSA, your flex dollars. Also, another good one is Care Credit. Care Credit offers 2 years interest-free, which I think is amazing. It's a very good tool in your financing area.
Interesting. And can
Yeah,
you tell us about I heard that there's like a cost savings calculator on the Dunes
there
website.
is. If you go to our website, there is a cost savings calculator, very straightforward, easy for you to use, and you can find out in your lifetime how much savings you will receive by getting LASIK. So it's a really good money saver, big time.
That's awesome. I think that covers everything that we wanted to talk with Lindsay there. If we want to move over to Stacy Spohr, if you want to tell us and give us a brief overview about your experience with LASIK, that'd be perfect.
Great, thank you. Well, when I was in sixth grade, I got my first pair of glasses and I wanted to get rid of them ever since. I upgraded to contact lenses when I was in eighth grade and just went on with life. For years, I was told I wasn't a good candidate for LASIK. And I talked to a lot of people who had LASIK and was excited to hear that it was quick and pain free. And I finally decided to take the next step when a friend recommended Dunes to me.
That's awesome. Do you want to tell us a little bit about your experience with Dr. Ferguson?
Sure. I had my free consultation with Dr. Ferguson, where we discussed the health of my eye and what I could expect from LASIK. I knew that I was in very good hands. I had my surgery and it went very well. I really didn't experience a whole lot of pain, a little discomfort for a few hours, but you sleep through most of it. And I can't express what it was like to open my eyes and to be able to see clearly. It's truly a life changer.
That's awesome. It kind of sounds like it's a no-brainer, but what was your main decider in getting LASIK?
My main decider was convenience. I was tired of having to rely on contact lenses or glasses to be able to see clearly. I also was shocked to hear about the benefits and how LASIK is safer and healthier for my eyes versus my contact lenses.
Awesome. And what is your vision like now?
My vision's great. I have no complaints at all. And I would highly recommend LASIK to anyone. And here's why. You don't think glasses and contacts are an inconvenience or a hassle until you don't have to rely on them anymore. It makes my mornings easier, it makes traveling easier, my vacations are easier, and it really makes life better. So I highly recommend it to anyone who's considering LASIK.
Awesome. And I kind of jumped around on our rundown here,
Okay.
but I'm going to send it back to you, Dr. Ferguson. Do you want to tell us a little bit about how LASIK works?
Absolutely. I would say that Stacy nailed the quality of life issue and question. So
Thank you.
next time, ask her instead of me. But how does this process work? And I think Lindy alluded to the beginning. First of all, you come in for a no obligation consultation. That's really important to both myself and to the patient because we need to determine what we're dealing with. Number one, we look at the complete structure of the eye. We have to make sure that everything checks off. Then we focus on the cornea. And the cornea is where we actually do the work on the front surface of the eye with the lasers. And that cornea has to be healthy. There can't be any abnormalities. That finding an abnormality is rare, but when it is, it's incredibly important. Okay. So we have to do a proper amount of evaluation. We have the state-of-the-art pentacam topography here, which is considered the gold standard for screening. Then we pay a lot of attention to tears. Tears are the most underappreciated, underlooked at, and underdiagnosed problem of the surface of the eye that impact vision recovery, health recovery. And so we have to be super sensitive at looking for any slight abnormality there and address that prior to LASIK. That's probably the number one issue once we pass through these other loops. And then so at that evaluation is fast. But then we have a roadmap. Then we can sit down and say, Marcy can interact with the patient, say, okay, this is what we have as your options here to treat, and this is what we're attempting to do. And we need to make sure that the patient's understanding of treatment, what their goals are, that type of thing are also met. And then we use a diagnostic test later called eye design, which I've already talked about. And so prior to surgery, then we'll come back and do an eye design test, which gathers more information. And we do a different assessment right before surgery that gets us that final information so I can create the surgery plan for my surgery partner. And so results are immediate. there's an immediate change to the curvature of the eye. So you have vision response immediately. You get off the table, your vision's changed. Now, it might be a little foggy or hazy. You just had surgery. So the recovery goes through stages. Next day, vision's quite good. In a month, outstanding. In some patients, we do 2 steps. We do step 1, and then we evaluate, and then we might do step 2 to finish it. I often tell patients this: when you're investing in LASIK at Dunes LASIK, you're paying for an outcome, not a procedure. So if we do an extra step, that we don't mind that. We want to do it safely, in the right approach, and to ensure that we're matching that patient expectation level and outcome and doing it in the right way. And that's what gives us the outcomes that we have. There's nothing that I've been involved with in our aspect of healthcare that gives results like LASIK. Done safely, with proper screening, using the best technology, and doing things every step of the way, not skipping any little point. And then we get very, very happy patients. And I say the most important result is 20 happy. It's not a number, it's 20 happy, and what that patient experiences.
I like that. And now that we're kind of coming towards the end of this, I wanted to let everybody know that's watching right now, if you have any questions about LASIK, please leave a comment. We'll be sure to answer all of those. I haven't seen any yet. So in the meantime, Dr. Ferguson, if you want to give us a brief overview, I guess, or review about everything that we've talked about.
Yeah, this is great stuff. I want to thank the panel for taking time, and thank you, Mason and Kaleidoscope Marketing, for doing these Facebook Live things. This is kind of new stuff for me because I'm not a social media person, except that our marketing team with Kaleidoscope is one of the best that you'll find anywhere in this. They do a great job for us, so that helps. But I think the overall takeaway is this. Number one, learn about LASIK. Gather information, be a consumer. That's really important. We don't want to sell you. That's not what we're trying to do here. We're trying to educate you. We are passionate about this. We love doing it. And this first step is just to get a good screening. Find out the options, make sure that everything is normal. Find out if you need to have anything addressed prior to, and then see what the goals are, what the potential limitations may be, if there are any, and then and really do your homework. And most of our patients actually have already made up their mind because they're referred by their patients. And we laugh about this and say, once you've had LASIK at Dunes LASIK, you're now part of our marketing team. And it's true. The vast majority of our patients come from other patients. And that's what makes this so fun. I mean, we've met so many people from about 150-mile radius around our office because of these relationships. We just did a 3rd family member the other day, and now we're talking about a 4th. And that's the fun part about this is the people you get to help and meet along the way. So we would love to see you come see us for a screening. And you can contact us, as Lindy said, a multiple ways through email, website, and or directly calling us. And it's a pretty efficient screening visit. And so that's the first step.
Yes, absolutely. And
Good.
we do have one question here.
Okay.
Does the recovery time, what is the recovery time for the procedure?
Great. So there's 2 stages. One, the day of surgery, you have about a 5-hour window where it's the initial step of recovery. So your eyes fairly, as you come out of the procedure, which is painless, then you'll have some discomfort. So patients often take a nap, and they miss most of that initial recovery. But remarkably, in 5 or 6 hours, that initial part of healing is complete, and the eye's feeling pretty good. Maybe a little scratchy, but actually pretty good. The next day, quite good. Most patients are ready to go back to their normal daily work activities and normal activities. We ask people not to do any heavy lifting for about a week and stay out of fresh water and things like that. But really, it's fast. Occasionally, we'll deviate from making a flap and go directly to the surface. That's a little bit delayed healing response, but sometimes that's the safer approach. So we do what's best for the patient and recommend that. But that's a minority of patients. The vast majority have this very immediate recovery. Visual recovery continues up to 6 months. It's crazy. It's like putting a dirty contact lens on your eye, and it gets better the longer you wear it. So your initial vision is good. but really good anywhere from 3 to 6 months. It just gradually gets better and better. So it's a pretty exciting process.
And going after that, we had another question here. Will my vision change after a few years?
Great question. In most cases, the vision is stable. There can be some variables, health of the body and health of the eye. As we get birthdays, more candles on the cake, we get formation of cataract in the eye, which all of us do, and that alters the vision a little bit. So there could be some of that. In very, very large, extremely high corrections, sometimes the eye will shift a small amount. The eye's like a water balloon, so it could change a little bit in its overall shape, which can affect curvature slightly, but very minor regression. So occasionally we'll see a patient that might have had surgery 15 years ago that comes in for a slight adjustment. But today's platforms are different than those 10 or 15 years ago. So vision stability, as long as your tear film, your eye health is good, vision stability is there for most patients. We call it the lifetime benefit.
That's awesome. Makes a lot of sense.
Yeah.
I think that about covers it for today. But before we go, Lindy, if you want to tell us, we have a Dunes LASIK kind of promotion going on now for a free Apple Watch. Do you want to tell us a little bit about that?
I'll tell you what I know, Mason. We currently have a Apple Watch promo going on. It is a referral to invite your friends and family. It's a little bit of a competition. And so if you want to win an Apple Watch, we have that promo going on right now.
And like Dr. Ferguson said, there's 3, I think, available. So it sounds like 3 winners in the end.
I want to win one.
We'll see if that's allowed.
Probably
but that's all we have for today. So thank you, everybody, for joining us. And we'll see you next time.
Thanks,
Thank
everybody.
you. Bye, everybody.
Thank you.
Bye.